Hi, my name is Dr. Tori Hudson. I'm a member of Pharmaca's Integrative Health Advisory Board. I'm a licensed naturopathic physician, been practicing 28 years in women's health, and certainly the dominant population of my practice is menopausal women. Sort of 40, 50-something and older, perimenopausal, postmenopausal women. So I want to talk in a very short amount of time a little bit about hot flashes, sleep, and vaginal thinning and vaginal dryness. And these are the three of the very common things that we see every day in my practice. For hot flashes, whether they're daytime or nighttime, I want to just focus right in on some of the herbs that have some great evidence and to be quite effective. Black cohosh extract has the most research on these symptoms, not just hot flashes and night sweats, some other symptoms too, but that's what we're talking about today. So black cohosh has the most research. Maca extract has a few nice studies. Kava has some nice studies on hot flashes. Red clover isoflavones. Even pycnogenol has one study. Fish oils have a couple studies for hot flashes. Then we get into some of these combination herbal products that have several different herbs in them together. And some of these can be effective as well, although there's less research on these combination products. And then Pharmaca has all kinds of estrogen and hormonal delivery prescriptions. And we're talking patches or creams or gels or troches or capsules in all different kinds of combinations. And most of the Pharmaca stores are compounding pharmacies. So if you have a practitioner that knows how to do compounding hormone prescriptions for peri and postmenopausal women, this is a very important service that Pharmaca serves, is to have these customized individual prescriptions, estrogen, progesterone, testosterone, DHEA, all kinds of combinations and all kinds of deliveries. Not only for hot flashes, but for the whole long list of menopausal symptoms. So you should expect relief, whether it's herbs or hormones, within about a month, or less with hormones, but I usually give the herbs a month. Another symptom I want to talk about is sleep problems. This is one of the most daunting, you might say, symptoms that can occur in menopausal women. Hormone changes in the brain cause neurochemistry, neurotransmitter changes in the brain leads to sleep problems, difficulty falling asleep, staying asleep, frequent wakening, early awakening. There are some natural agents, melatonin, L-tryptophan, 5-hydroxytryptophan, valerian, hops. These are some of the key ones to look for. But remember, if you're having other perimenopausal symptoms, including sleep, we need to think a little bigger. We might need to think, oh, this brain actually needs estrogen and progesterone and the melatonin and the tryptophan or valerian. Or it needs a black cohosh or maca extract to address the underlying menopausal hormonal part and the L-tryptophan or valerian or melatonin. So think underlying cause, address that hormonal issue, whether it's herbs or hormones, and then address that specific issue of sleep. And when you think that way, we're going to get a lot better results. And the third thing I want to talk about is vaginal thinning and vaginal dryness. And this can lead to burning, itching, discomfort during sexual activity, or just normal everyday life. And this is a result of a drop in estrogen in the body, and that drop also occurs in the vagina. We have some self-help things like some moisturizers, whether it's a pharmaceutical moisturizer or a natural ingredient herbal moisturizer. Those can provide some relief, although they don't really tend to get to the core of the problem. And to get to the core of the problem is vaginal estrogen. And there are some regular prescription items that any doctor should be familiar with, but then there are also some specialty compounded, natural, bioidentical estrogen compounds, estriol, estradiol, and creams and suppositories that from a doctor who's familiar with compounding of these great products, Pharmaca can serve this purpose and give some nice individualized options that include ingredients that you don't have reactions to. You don't get irritated by the ingredients in the suppository itself. So that's a quick rundown on hot flashes, sleep problems, and vaginal thinning and dryness in menopausal women. And there's lots more to learn, but I think that'll get you started. Thank you.